It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Next up, Dr. Anissipour talking about minimally invasive spine surgery. The spine is obviously a very delicate structure, and we're going to get more information. Here is Dr. Anissipour and Shannon O'Kelly.
Dr. Anissipour, welcome to Health Talk. How are you?
I'm doing well. Thanks for having me, Shannon.
Thanks for joining us. As Tom said, you're an orthopedic surgeon with a fellowship in spine surgery. So let's talk about that fellowship. I always like to kind of ask about your practice, your area of interest, how you got interested in spine. It's a very complex area.
Sure. I do have a background in orthopedic surgery as orthopedic trained in Chicago, Illinois. And as I went through that training, I grew both a love and passion and interest for spinal surgery. So I veered most of my training towards that direction. And then afterwards, I went and further subspecialized at Harborview Medical Center here in Seattle and at the University of Washington, where I specialized in both complex spine and spinal trauma. When I came out of my training, I decided to dedicate more of that complex techniques that I learned at Harborview and apply more minimally invasive and modern techniques to my practice, kind of encompassing being able to apply both minimally invasive techniques to both simple and complex problems of the spine.
Well, let's define, if we can, just for our listeners. I mean, you said simple and complex problems of the spine. Let's categorize that as simple versus complex, maybe, if as much as we can on the radio here.
Sure. There's the everyday sort of bread and butter problems that people run into, including herniated discs, both in the back and in the neck, that cause pain that shoot down the arm or down the leg, respectively, or just spinal stenosis, which is a narrowing of the spinal canal that happens to many of us as we age, and that squeezes the spinal nerves and causes a sense of heaviness in the back and the butt and the legs, and that makes it difficult to walk long distances, and people commonly find themselves needing to lean forward or bend over a shopping cart or sit down just to get relief. Those are more sort of everyday problems of the spine that are easily addressed through surgical means. And then we get into the more complex problems where the spine is breaking down, starting to slip, degenerate, or even develop a curve in it, like a scoliotic deformity.
Wow, okay. So you like to, obviously in your practice, you're seeing both, but you talked about specific training in the complex area, and you talked about taking a complex situation in the spine. In my opinion, everything in the spine is complex, but I mean, it's a very interesting area. And believe me, if you have back pain or have experienced back pain, you see patients all the time in your office, back pain can be debilitating. I mean, but you talked about minimal invasive surgical techniques for complex issues. Let's get into that because I'm interested to find out what you're doing. We talked a little bit about robotics. Let's get into that and talk about robotics and the use of technology in spine surgery.
Sure thing. I think minimally invasive surgery is on the forefront of sort of all specialties of surgery, but I think it's really important to focus on in spine surgery and what it does for a patient and what is it. Well, traditional spine surgery involves making a large incision down the middle of the spine and dissecting or cutting those muscles and separating them. And all those important muscles of the low back are opened up so that the surgeon can look at the spine in an open sense and visually see the spinal anatomy to do their surgery. In minimally invasive spine surgery, we now keep the skin, the muscles, everything preserved, and we make little tiny incisions and focus a directed attention right down to the area of interest. And doing so preserves those important muscles, so all that blood loss, scar tissue, and recovery are all enhanced doing these techniques in a minimally invasive fashion.
And when you talk about doing these techniques in this minimally invasive fashion, I mean, in a small incision, can we call it a portal that you're going down and you're using microscopes and the technology is pretty advanced. So instead of having a long incision, like you said, it's a small port area and you put instruments in there and you can do a discectomy through that opening now.
Oh, absolutely. You can do far more than that now. You can not only get to the spinal nerves, do a discectomy, do a decompression, address spinal stenosis, all through a little 18-millimeter tube. But now with the assistance of more advanced technologies like the robotic technology we're going to chat about, we can now place screws into the spine. We can place cages within the spine to realign and reconstruct the spine all through these tiny incisions.
Our conversation with Dr. Anissipour and Shannon O'Kelly continues after this time out right here on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
More with Shannon O'Kelly and Dr. Ali Anissipour.
Dr. Anissipour, again, thank you for joining us on Health Talk. Thanks for talking about complex and simple back surgeries and, more importantly, minimally invasive surgeries. But let's talk about the use of robotics here in the Northwest, and particularly at Everett in your location of Providence there.
Yeah, this is something that's very exciting. The very first Mazur X stealth system, which is a new evolved robotic system, has just hit Washington State, and it's up at Providence Regional Medical Center where I practice. And what this system does is we take a CT scan of the patient's spine before surgery, and then when we lay the patient down in surgery, it merges that preoperative CT with that patient's spine on the table. So now it projects a three-dimensional image of the spine on the monitor and without having to cut open the skin. And so I can see the entire spine. And now with the use of robotics, it places an aiming arm and says, right here, if you target, you can cut and target straight down to this spot. And within a millimeter accuracy, you can place a screw or place a cage or do other important techniques in the spine, all through these tiny incisions under robotic guidance.
Unbelievable. So, in a nutshell, let's summarize this. You're still doing the surgery. As the surgeon, you do the surgery. The robot's not performing. This is not like the Jetsons where the robot's cleaning the house, right?
Exactly right. Exactly right. You still need the skill of an experienced spinal surgeon to perform the technique, but now we have technology that allows us to do it in a extremely accurate, precise, and minimally invasive way.
So talk about the use of the robotics in what you like to do. One of your passions, I think you mentioned, is complex surgeries. Does that robot enhance the outcome for the patient?
I believe it does, very much so. Now we can address complex problems by placing very accurate and precise screws within the spine and then realign or derotate the spine back into its normal position with incredible accuracy and power.
You're talking about doing this percutaneously. So again, these are small incisions. You're guiding those screws, that hardware. So you're not taking down the muscles or cutting ligaments or tendons. The soft tissue trauma that a lot of times in years ago, the surgeries could be problematic is not there anymore.
That's really the key. It's not just that we're doing it all through a bunch of or a few small little poke holes, but it's the soft tissue trauma that's the key, because not only do we want to get the spine back into sort of perfect alignment, but we want that patient to be able to get up and go to therapy and mobilize really early on without all that scar tissue and pain that holds them back and keeps them in bed.
And where'd you learn this technique? I got to ask, is this like something you've been looking at? How'd you identify it? And how'd you get it at Providence Regional Medical Center and Everett? That's pretty neat.
Well, Providence was supportive of my goal, but I've always wanted to be on the cutting edge of spinal surgery and these techniques because I believe so strongly in it, because I see such a huge difference in patients that are opened up and undergoing the traditional old techniques versus my patients that are bouncing back really quickly with more these less invasive techniques.
Wow, amazing stuff. Again, medical technology at its greatest right here in the Northwest. Dr. Anissipour, thank you so much for your time, and congratulations on this new technique that you're using.
Thank you. It's very exciting, and thanks for having me.
Been talking about the spine, minimally invasive spine surgery with Dr. Ali Anissipour, and as we mentioned at the beginning here, this is a very delicate operation, Shannon.
It's an amazingly delicate operation, but Dr. Anissipour is now using a robotic-assisted devices, as he talked about. He's doing fascinating stuff with the spine and surgery with great outcomes.
You can get more information, www.medgroup.com. Final segment's coming up after this time out on Como.